I would like to address the lifestyle concerns of the LGBTQ population, particularly homelessness. Why is this group of individuals dealing with these negative lifestyle factors at an increased rate from individuals outside of this group? What are the correlations between mental health and physical health? And what does being homeless do to our overall health? When an individual faces social isolation or rejection, the receptors in the brain that are targeted are the exact same receptors that are targeted by physical trauma or abuse. Physical pain, as well as the feeling of social rejection, stimulates the dorsal anterior cingulate, as well as the anterior insula of the brain. It begs to ask the question, does being rejected physically hurt us? Maybe not physically, but the mental burden of rejection can be a heavy one. There have been studies that show strong social ties, meaningful relationships, and social acceptance as being buffers against many mental health issues such as depression. One of the populations that faces extreme social isolation is the LGBTQ or queer community. Until 1973, homosexuality was listed as a disorder in the Diagnostic and Statistical Manual of Mental Disorders. Being transgender was included as a gender identity disorder up until 2013. That is extremely recent in our history of medicine, and in spite of the growing acceptance of this lifestyle, there is still a very heavy stigma towards this community. More than 95% of the LGBTQ youth population feels separated and emotionally isolated from their peers because they feel different. Almost half of gay youth are verbally or physically assaulted in school and are 4 times more likely to be threatened with a weapon on school property. So it is not surprising that they are 5 times more likely to miss school for fear of personal safety. Studies also show that nearly 45% of the LGBTQ youth are facing homelessness as a result of rejection of family and community. With this rejection and lack of social support comes the stress of being isolated. Homelessness, in addition to that already present stress, only adds more as every day becomes a struggle to find a place to sleep, to find the next meal, and to find shelter from the elements. Homelessness also increases exposure to things such as substance abuse, crime, and violence, all of which are significantly higher among the homeless population. Seeing as there are few places where homeless people can go and feel safe and accepted, studies show that more than 1/3 of them spend their entire day alone. This social rejection can play a huge toll on mental health of any individual, especially ones who may already feel emotionally and mentally vulnerable due to falling victim to other unfair social stigmas. Being homeless is already incredibly depressing on its own, with 61% of the homeless community experiencing some sort of suicidal thoughts. But the rates of suicide among the LGBTQ individuals are 4 times higher than that of heterosexual populations, and 40% of this population has actually attempted suicide. Because of the compounding effect of large-scale rejection by significant portions of the society, added to personal struggles such as homelessness, this community is at a much higher risk for mental health issues like depression, anxiety, suicide, substance abuse, and obesity. Health disparities among the queer community are increased in number, partly due to social stigmas and the fear of rejection by their healthcare providers. Ultimately, this creates a barrier between these individuals and receiving healthcare. Many LGBTQ individuals feel that they cannot connect or be understood by their healthcare provider, and therefore they do not seek the treatment and the care that they need. Some things that are important to note are that LGBTQ individuals are at an increased risk for mental health disorders, and there are also 7 cancer sites that affect this community disproportionately. These are anal, breast, cervical, colorectal, endometrial, lung, and prostate cancers. This may be due to a variety of risky lifestyle behaviors, a lack of routine checkups, and also a lack of education. As healthcare workers, it is crucial that we welcome this community with open arms and hearts, providing the support that is still needed for this population to thrive and live healthy lifestyles. Still, 1 in 5 of practitioners will turn away patients who are openly queer, and 53.8% of healthcare providers felt as though they were not adequately educated in this population's health needs, according to a study done by the Journal of Clinical Medicine. In accordance with these statistics, 36.1% of the LGBTQ population surveyed reported that they completely avoid medical care due to difficulty in communicating with their healthcare provider. If this community is in greater need of acceptance and healthy lifestyle efforts, why do we not know what we should, and why are we still turning them away? It is important that we educate healthcare providers, parents, schools, and youth about the risk factors associated with LGBTQ lifestyles, signs and behavioral patterns to look out for, and how to create safe and healthy lifestyles among this population.